area of interest is Marma Chikitsa. So we will be talking about the global outreach of Marmas, and we will be seeing some of the feedback of the patients initially and how Marmas have benefited different patients in different parts. And then I will tell you what I do in those cases, and then how you can identify those important Marma points and can self-do for your own benefits. So this is a patient of frozen shoulder whom I treated when I was in Cancun in Mexico, and it is a case of secondary frozen shoulder. So this patient was suffering with the problem for almost 6 months when he visited me, and you can see the range of movement of the patient before treatment and the facial expression as well. So this is the range of the movement of the shoulder joint, and this patient had been treated through various other means, but the effect was not satisfactory. So this is before treatment. As you can see, it was less than, I think, 70 degrees or 60 degrees almost. And this is the same day after doing the Marma therapy. The range of movement improved by almost 30 degrees, and the patient said that the pain has decreased by 40%. That was on the same day after doing the Marma therapy. So now you can see the range of movement has improved. This was before treatment. This is before. And this was after. Right. So then what I did was I could not stay with him for very long, and I taught the patient how to do himself. So the patient did himself, and after 1.5 months he shared another video, and we can see the video of the patient now. So almost all the range of movement of the shoulder was back, and in this patient I did not give any medicine. I only told him what to do for the Marma therapy. And I told him how to do it, and he followed it religiously, and after that 1.5 months he was absolutely fine. This is another patient of secondary frozen shoulder. She is a patient from Switzerland and visited me when I was in Berlin, and this is the range of movement of the shoulder joint before, and this is again after. So this was before and this is after. So you can see the improvement after the first sitting of the Marma therapy. This is a case of hemiparesis which was in Singapore. Of course, such cases need longer interventions. So this is the range of movement of the shoulder joint before treatment. The patient was suffering with hemiparesis for almost 3 years. And this video now you can see here. So now he can raise the shoulder joint much better. And so again, this patient also I taught. The lady who was standing there is an attendant of his, and he was an owner of a chain of restaurants in Singapore. Of course, he lost much of his business after this problem. This is a case of macular edema, and it's a very, very difficult one to treat. And although I'm not a specialist of eye, but my wife is, so I do discuss with my wife when I do such cases. So this is a patient who was treated in Italy, and this is an OCT of the patient where there's a lot of edema in here, and after 3-4 months the edema had reduced. And actually I had only 2 patients treated with this problem so far at the time when I treated in 2019 this patient. So I told him that, you see, I cannot promise you with only 2 patients that you will get a result in this because it's a difficult one to treat. However, if you want, then I can tell you based on the concepts and what I did in those 2 patients. So this patient had already taken 5 injections in the eye, and the patient was due for another injection. So he wanted to do the Marmas, and he did himself for 4 months. And also I told a couple of Ayurvedic procedures along with this. And when I went again to Italy, his vision had actually improved. This is a lumbar canal stenosis patient, and a lot of patients of such problem are nowadays told to go for surgical intervention. And even in this case, after 1.5 years, this is treated by one of my students. in Jamnagar, Gujarat Ayurveda University of 1.5 years, and the MRI also showed improvement in this. So you can see the regression in compression element, which is mentioned here in L45 and L5S1. And we have had different sessions in different parts of the world with Marma therapy. This is in the United Nations headquarters, invited by the WAFONEF. It was the University of Cologne in Germany. We had some session for the nanotechnology scientists. Then it was in Indian Embassy in Tel Aviv. Then this is in Tel Hashomer Hospital in Israel, considered as one of the best hospitals in the world. And we did a session on PTSD. PTSD is post-trauma stress disorder. So there are a lot of patients suffering with this terrorist activities there. So the patient who visited actually was suffering with this PTSD problem, where the terrorists had tried to slit his throat, but he survived. He still had a bullet wound in the calcaneum, in the bone, but the main problem which he was having was PTSD. So we did it in this patient also in front of all the best doctors there in Israel. And this was an Indian Embassy in Hague, and this was in Poland. So different parts of the world. There are around 450 government Ayurvedic medical officers in Nepal, and this is with the Honorable Health Minister of Nepal. So it is a program run by the government of Nepal for 450 Ayurvedic medical officers and around 1,500 paramedics. So this was a patient again in Lisbon. There are a couple of patients with stress and anxiety. And nowadays, since the topic today is occupational lifestyle diseases, but stress and anxiety is a very, very major issue. And these two the ladies actually did those Marma practices, which we have shared with them, and they are sharing the feedback. I'm not going to repeat all of them because they are in Portuguese, so you don't understand. However, they have actually mentioned in the gist that they felt much better with the application of the Marmas. So then we did some sessions in Melbourne and Perth, and this was with the Honorable Consul Generals of in the Perth and of course also Melbourne. Then in Mexico we had some good sessions, and this was actually attended by 1,200 people from 25 different nations regarding this Marma Chikitsa, and of course there was also a yoga conference there. So this was in Cagliari, Italy. Professor Medio is already here, so he had invited, and we did some sessions for them there. And this was in Lisbon in Portugal, so we did some Marma sessions. So world over, people are looking to us to learn the science of Marmas. And also in New York, the costliest place in the world, Times Square, we did this session. Then some Brazilian groups in Rishikesh, of course. There are so many, right? So also, and more than 20 states of India have trained the different doctors and paramedics as well from different fields. So this was again in Singapore. The lady sharing her feedback regarding tennis elbow. So she was suffering with tennis elbow for a few months, but was not getting adequate results. But then we did the Marmas to her for a couple of times in 2020, just before COVID came. And then after that, she'd also do it for 1 week to 10 days on herself, and then she was fine with the tennis elbow. So there are some different workshops online these days, and for this is a medical university in Brazil that we did for some of the doctors there. So now what is Marma? So basically Marma therapy is the art of stimulating the Marma points exactly at the right time, place for rechannelization of energy, yielding better energy flow, and optimum therapeutic effects at physical, psychological, and spiritual levels. So today we are talking about consciousness. Actually, Marmas are dependent upon these inner energies. So there are different historical backgrounds. The first reference of this comes in the Rig Veda, where the term therapy was used. And of course in Ayurveda also there has been a wide description of these Marma points. So there's also an intricate relationship between Marma and Yoga, Ashtadasheshu, Marma Sthaneshu, Kramata Dharanam, Pratyaharas. So we're talking a lot about Yoga today. There has been a lot of the intricacies or you can say interdependence of Marma and Yoga. It is mentioned, Pratyahara Prashasanti Sanyanta Yogina Sada, Ashtadasheshu Yadvayor Marma Sthaneshu, Dharanam. Sthanat samkrishya pratyahara sacha uttamaha. So what they're saying here is you have to do the dharana kriya or conscious meditation on ashtadash or 18 Marma sites. So for example, the first one they have mentioned, in Chandogya Upanishad is the Pad Angusht Madhya. So this means that in between the great toe and the second toe, there is a point of energy point where you need to do this conscious meditation or the Dharana Kriya, and then you go gradually upwards, like in the ankle, and then you go to the in between the leg where you have the end of the gastrocnemius muscle or the calf muscles ending. So there's a point there, so it is called as Pindika Madhya. So in Ayurveda it is termed as Indrapasti. So these are some of the points that they have said about, and you have to do the conscious meditations on these 18 and gradually raise yourself up to the navel region, heart, and then up to the Sahasrara chakra. So this process is called as Pratyahara. So in Ayurveda, it is also mentioned Maryanti iti Marmani. That means if there is severe injury on the marmas, it can lead to fatality because they are very sensitive points, right? So earlier what was happening was people thought that if you touch them, maybe something fatal can happen. So what was happening in Ayurveda was a lot of thesis work was being done on the anatomical perspective of understanding the marmas, but not much clinical work on the applications or the stimulation of marmas were being done, because they thought that if you touch or you do something on the marmas, it can lead to fatality, because it is mentioned Maryanti iti Marmani. So if there is severe injury, it can lead to fatality. So then I talked to the ethical committee when I gave one of the topic to the postgraduate students there. So I talked to the ethical committee and told them, you see, every day you are touching the marmas in one way or the other. Like for example, if you are applying oil on the hair, there are certain points that you are stimulating. There are certain processes in Ayurveda, like Hriday Basti, you put some oil on the heart, or in Shiro Basti, there's something on the, or your Shirodhara where oil is put on the forehead. So there are certain points which are getting stimulated with a very gentle pressure. It's actually producing therapeutic effects rather than causing any injury, right? So what acharyas would have meant by the injury was that it is a severe trauma, because Hriday is a marma point. So if there is severe trauma, we know that it can lead to fatality. That is quite right? So then the thesis got cleared, and now in different parts of India and also abroad, people are doing more and more work on marmas, and in different universities, national universities, also there are postgraduates and PhD thesis work now being done. So we have to understand the probable mechanism of action, why the patient was having better relief and why the patient was able to lift his arm. And so based on energy concepts, we can understand this very important experiment. You see, this is a water droplet energy field, and this is a famous experiment by Professor Korotkov and their team in St. Petersburg University in Russia. And what they did was map the energy field of water before doing a conscious meditation, because all of us, we have certain energy within ourselves. It is just that we are not able to understand that energy field or express this energy field. Because suppose when a woman walking ahead, she doesn't see someone coming from the back, right? But still she feels that someone is following, which we call as sixth sense, right? Sometimes it happens. And sometimes you're sitting on a table across and you feel that the person is not right one to talk to. So you are feeling the energy field of the person. Of course, you are not able to express it, but you feel it. One day you wake up in the morning, you feel like you want to do everything, but one day, even though if you don't have any disease, but you don't want to do anything. So this experiment by Professor Korotkov gave a scientific basis to this energy concept or the energy healing science, and what he did was map the energy field of this water droplet before, and after that he asked an energy healer by the name Alan Schuma during 10 minutes of conscious concentration, right? So this was the energy field which you can see it is mentioned. The difference in the bioenergy glow is dramatic. The biocharged water has more than 30 times a stronger aura vibration and significantly altered physical and biological properties. If you can change bioenergy field of water, you can change human bioenergy field, because we are 70% water molecule, right? And this experiment has been used in different other research workers. This is a kind of meta-analysis. I'm not going to be more scientific, but this is a collection of 132 papers which was published based on this. And the best thing is here it is mentioning there in this energy fields and electrophotonic analysis, they say that the calculation of the GDP or the chakra is based on the idea of Ayurvedic medicine. So for each chakra, the program produces the value, asymmetry, and interpretation of chakra energy in compliance with Ayurvedic concepts. So this so vital experiment has its basis in Ayurvedic sciences.
Cool.
So we did some more work and published them. So these are some of the PG theses completed. So now I'm coming to what we did in such patients. What are the methods of stimulation? There are various ways in which a Marma point can be stimulated, but we use our hands to do the stimulation, since it is mentioned that hastameva pradhanatam yantram, that means our hands are the best instruments. So we use our hands to stimulate these Marma points, and that is what I will be talking to and I will be sharing about. So for cervical neck pain, maybe musculoskeletal or neuromusculoskeletal origin cervical neck pain, we are doing these 4 Marma points. Now how to identify them, we will see gradually. So for frozen shoulder that you saw, we do these 4, that is the Ans, the Kakshadhar, Kurpar and Chipra. Then for tennis elbow patients, we do these 3, that is the Ani, the Kurpar and the Chipra. We will see this because I'm sure this will be an alien term to all of you, but we will see this gradually what they are. So the Ans Marma is located just where I can show you one video. So this is the point of the energy point, you can say, and which is approximately 2 finger breadths from the point where the neck joins the shoulder, and from here you have to make a line, imaginary line towards the sternal notch or the front of the neck. You have to make an imaginary line and apply pressure and intermittent pressure towards this point. So what we have to do is hello, yeah. So these 4 points are easy to do, because many times you wake up in the morning, sometimes you get stiff neck. Even in those cases, you can do the simple stimulation where you use the pulp of the thumb, the middle finger and the index finger, place it here and apply pressure towards this point. This is an intermittent pressure in the same rhythm in which we take our breath in and out, right? So press while you are exhaling and release while you are inhaling. So keep the elbow close to the chest, and at this approximately 30-degree angle you make from the mid-axillary line, like here, and use the pulp of the thumb to apply pressure towards this side. So 20 times in one sitting and 2 to 3 times in a day. One press and release will take approximately 3 seconds, right? So because our breathing rate is approximately 18 times per minute, so one press and release will take approximately 3 seconds. In a day, you can do 2 to 3 times, depending upon what case you have, right? If it is a cervical spondylitis or cervical spondylosis, in such cases, you can do that. If you are sitting long duration in computers also, you can do this, right? So again, I'm going to repeat, this is called as Ansaman. So you have to place your finger here and then apply pressure. Pressure is a moderate pressure, and when you are applying this, it is to be kept in mind that we should not put the finger too close to the neck. It has to be backwards, right? It should not be too close to the neck. So like this. The other fingers can be kept closed and then do the stimulation. So this is one, it hardly takes 1 से 1.25 minute तक लगता है, उससे ज़्यादा टाइम इसमें लगता नहीं. So this is one Ansman. Then the other one is Kakshadhar, which is lying close to the shoulder joint, and ये जो bone यहाँ unite होता है, इससे सिर्फ करीब 1.5 से 2 अंगुल नीचे, बहुत ज़्यादा नीचे जो softer area है, उस पे नहीं जाना चाहिए. अगर softer area पे जाएंगे तो फिर injury हो सकती है, जो vessel और nerves यहाँ से जा रहे हैं. तो softer area पे नहीं जाना है. तो ये जो थोड़ा सा ऊपर की तरफ है, और आपके जो feel होगा वो जो bone है head of humerus, उसका bony contour आपके thumb पे feel होगा. So you can actually place your finger like this and apply the intermittent pressure again backwards and upwards. जो डायरेक्शन ऑफ प्रेशर है वो ऊपर की तरफ होगा और थोड़ा बाहर की तरफ होगा, नीचे की तरफ प्रेशर बिल्कुल भी नहीं लगाना चाहिए, ठीक है। आपका हाथ बिल्कुल सेंटर में है, थोड़ा आउटवर्ड होगा। आई एम गोइंग टू शो वन वीडियो। सो दिस इज द लोकेशन एक्चुअली ऑफ द कक्षधर मर्म। तो इस एरिया में, सॉफ्टर एरिया में फील नहीं करना है। ये जो बोन है, ये क्लेविकल है, इसको यहाँ इसको एक्रोमियोक्लेविकुलर जॉइंट कहते हैं। इससे करीब 1.5 से 2 अंगुल नीचे ये वाला पॉइंट है, और यहाँ से फिर प्रेशर जैसे इस तरीके से लगाएं, थंब से ऊपर की तरफ प्रेशर लगाना है, नीचे की तरफ कभी भी प्रेशर नहीं लगाना है। अभी जो जितने भी मर्म पॉइंट हम बताएंगे, दैट हैज टू बी डन like 20 to 25 times in one sitting. It is an intermittent pressure, not a continuous pressure. While you are pressing, keep pressing for 1 second and then release. So one press and release total will take 3 seconds approximately. Hello. So you can see I'm showing here. Hello. I'm just showing the landmark. Hello. How to identify. So this is of course the clavicle, and it's a joint here, right? Acromioclavicular joint, and you go 2 finger breadth below. So this will be the point of stimulation. So you see this is the point of stimulation, and if I have to do to a patient, then I'm going a bit faster because we have certain time constraints, I know. So I'm going a bit faster. So this is how we have to place. If I am doing to a patient, then this is how I do, by placing the 4 fingers in the back and using the pulp of the thumb to apply pressure upwards direction. So this is what I'm saying here. Do not press on this softer area. Now I have another how to do the self one. So this is, you see, I'm showing here how to do the self. So you hold your arm like this and place the thumb on the side here and just apply pressure backwards and upwards. Again 20 to 25 times. It's a moderate amount of pressure. You can use up to 6 to 8 pound pressure while doing both of them, like the Ans murm or this murm. Now अब 6 से 8 पाउंड कैसे पता चलेगा? तो उसमें आप किचन पे पेइंग स्केल होता है, उस पर थंब पे प्रेशर रख करके देख सकते हैं कि कितना रीडिंग आ रहा है, और उसी के लगभग प्रेशर इसमें लगाना होता है। थोड़ा कम लगाएंगे तो ठीक है, ज़्यादा नहीं लगाना चाहिए, ठीक है। So this is how again you see is basically my son who is doing. Okay. So this is the Kakshadhar Marma. So these are some of the vessels and nerves passing through underneath. That is why I said कि नीचे की तरफ प्रेशर नहीं लगाना है, हमें इस पर नर्व को इंजर नहीं करना है। Now चूँकि हमने गोल्फर्स एल्बोज और टेनिस एल्बो भी बताया है, तो उसको आइडेंटिफाई करने का तरीका इस पिक्चर से बिल्कुल क्लियर हो जाएगा। तो इसमें जो आनी मर्म हमने लिखा था, ये अगर ये एल्बो को फोल्ड करते हैं, तो फोल्ड करने पे जो क्रीज बनता है, तो दैट इज इस क्रीज से करीब 3 अंगुल प्रमाण ऊपर होता है, और ये अगर एंटीरियर जो मिड लाइन है उससे 1 फिंगर ब्रेथ मीडियली, मतलब अंदर की तरफ। तो दिस इज द पॉइंट फॉर द आनी मर्म, और इस पर हम लोग इंटरमिटेंट प्रेशर अगेन लगाते हैं। 3 मर्म को करते हैं टेनिस एल्बो और गोल्फर्स एल्बो के केस में। एक तो आनी मर्म, एक कोरपर मर्म है ये, और ये इंद्रबस्ती। सो दीज 3 मर्मर्स दैट वी डू इन सच केसेस, राइट। एंड yeah, so this कोरपर मर्म identification is again this midline anteriorly, इससे 3 अंगुल प्रमाण लेटरल बाहर की तरफ और 3 अंगुल प्रमाण अंदर की तरफ। तो दोनों तरफ है एक पॉइंट। कोरपर मर्म का ही 2 पॉइंट ऑफ स्टिमुलेशन है, एक तो बाहर की तरफ है और एक अंदर की तरफ है, और ये जो एल्बो का क्रीज है उससे लगभग 1 फिंगर ब्रेथ बिलो। सो दिस इज द पॉइंट एंड दिस इज अनदर पॉइंट, राइट।
तो इसमें ये आइडेंटिफाई करने के बाद इंद्रबस्ती मर्म को सिंपल आइडेंटिफाई करना, अगेन इसी एल्बो क्रीज से लगभग 4 अंगुल प्रमाण नीचे जाएंगे तो ये इंद्रबस्ती मर्म होता है। तो अगर हमें आनी मर्म को करना है तो हम लोग एल्बो को हल्का सा फ्लेक्स करके, बिल्कुल स्ट्रेट नहीं रखना चाहिए, अगर बिल्कुल स्ट्रेट रखेंगे तो ये मसल्स स्टाउट हो जाते हैं, तो इसको थोड़ा सा फ्लेक्स करके, हल्का सा मोड़ करके, तब यहाँ पे हाथ थंब को रख के प्रेशर डाउनवर्ड्स और टुवर्ड्स अ इमेजिनरी पोस्टीरियर मिड लाइन, तो इस साइड हम उसको प्रेशर लगाते हैं इस तरीके से, ठीक है। तो दिस इज आनी, एंड नाउ फॉर द कूपर, टेक दिस जैकेट ऑफ।